Hi, I would like to welcome everybody to today's training on systematic child abuse and neglect assessment. I'm your presenter, Cecilia Den. We have a lot to cover today, so let's get started. Okay, so we're going to talk about what we're going to discuss today. What is defined as child abuse, risk factors for child abuse and neglect. We're going to review the signs of child abuse and neglect in infant and toddlers. The signs of child abuse and physically and medically, and the signs of child abuse socially and emotionally. We're going to explain how to assess the effects of child abuse and neglect on individuals and families, indicate what questions to ask to determine what type of abuse has been perpetrated, and what type of treatment is needed for children and families, cultural factors to consider when assessing children that have been abused or neglected, steps to report suspected abuse or neglect in California, and where to find this information, and steps for mandated reporting in California. What is child abuse? Child abuse is intentional maltreatment and traumatic harm of a child that is under the age of 18. Common types of abuse include psychological, emotional, sexual, physical neglect, as well as exploitation of a child. Child abuse is a critical public health issue that can have lifelong impacts on the victim's life. Let's look at some risk factors for child abuse and neglect. In cases where the perpetrator has a history of maltreatment, the perpetrator or joint perpetrator and caregivers may abuse drugs or alcohol. When the parents are having marital relationship problems and the family violence is taking place in the form of domestic violence and verbal abuse. When both parents are struggling with mental and psychiatric symptoms. When the child comes from a low socioeconomic status where the parents and caregivers fail to provide basic necessities that will ensure their child's safety, growth, and development, such as having an adequate supervision, adequate housing and food, medical care, and educational neglect. A risk factor that has been identified as parents who had children at a very young age. Children are most dependent on their caregivers, such as very young children with disabilities, such as chronic intellectual and physical impairments. Children with special needs require multiple adult care providers for health care needs, and care may increase the chances that the child will experience maltreatment. Risk factors that are found in the community include living in a neighborhood with high crime and violence. So I broke up the signs of child abuse and neglect into 3 different slides because there's so much information. And I started with infant and toddlers. So let's go ahead. While many of the symptoms infants and young children have can be the same for older children, here are some signs of child abuse particularly seen in younger children. Behavioral symptoms in children as young as infants. You might see excessive crying, anxiousness, and rebelliousness. The infant or young child may have phobias, night terrors, and sleep disturbances. May seem excessively clingy to someone other than the caregiver, or on the opposite end, very rebellious and just wanting to get away. Mental and physical symptoms include noticeable delays in growth, stature, and intellectual deficits where the child may have speech and cognitive and gross motor skill delays. Signs of neglect seen in very young infants to older children include noticing the child seems very sick, chronically sick, and is not being treated for easily treatable illnesses. Furthermore, the child may lack dental care, medical devices such as hearing aids or glasses, or ensuring that the child has immunizations. The child may seem continually dirty in unclean clothing and lacking appropriate clothing to keep warm or cool based on weather conditions. I wanted to review the signs of child abuse that affect a child physically and medically. So here are some physical signs. If the child has notable injuries on the body, such as bruises, burns, to more extreme injuries, such as broken bones, fractures, injuries to face and the mouth and the eye, going from potty train to bedwetting. Other signs include the child reporting chronic headaches and abdominal pain, problems sitting down or having pain when they walk, chronic sicknesses such as upper respiratory infections, sore throats, and worsening medical conditions. Failure to thrive is a term that is used to explain when the child is unable to gain weight or grow properly and may gain a considerable amount of weight. Medical signs of abuse also include noticeable and oral injuries, disorientation from head injuries, head fractures, and lastly, if the child reports that their genitalia has pain and the child is having bleeding or has swelling. Other signs are that the child may have knowledge of sexual activity and practices that the child should not know about. So signs of child abuse in the social and emotional aspects include infants and toddlers may be unable to communicate or have no desire to try. They do not seem to have an interest in learning through play and do not want to explore their environments. Social signs of child abuse would be noticeable speech delays, as well as delays in social and emotional development. They may have trouble forming friendships with other children. Emotionally, some emotional signs are that these children might act out physically and verbally, hurting others, including animals. Children may display a lack of impulse control, which means they cannot control their emotional states or have coping skills to handle stressful emotions. Children enduring child abuse will display signs of social withdrawal and not striving to do their best in school, and they may also miss many days of school. So how to assess the effects of child abuse and neglect on individuals and families? Initially, the therapist might explain the informed consent process. Furthermore, the limits of confidentiality with the clients. Firstly, the child and family would be given certain assessments to check for safety in order to evaluate the potential risk of harm. Ensuring that a child is safe and secure is important during the assessment process. For instance, if a child feels unsafe, it is unlikely that they are going to disclose abuse in an honest manner. The therapist would proceed using broad-band scales, but also other measures such as a clinical interview to look for some immediate indicators of child maltreatment and neglect. Also in trauma-related symptoms, such as examining the family's environment and issues related to poverty and social isolation. They would also look at cultural norms and language skills and beliefs that the family holds. Other areas assessed include observing the emotional and behavioral state, the developmental milestones, and examining a history of if the family has had violence before. If the family matched the criteria, this would put them in a higher risk for child maltreatment. It is imperative to use a trauma-focused screenings and assessments, such as the trauma-focused checklist for children and young children. If present danger is identified, then it would be imperative to obtain reports from several sources and not simply screen the victim alone. Giving the non-perpetrating parent A self-report allows the caregiver to address concerns they have as well as screen for mental health conditions, which helps the therapist to understand whether or not the caregivers have untreated mental health conditions, because these can impact their ability to provide a healthy family dynamics. The therapist would also seek to get reports from other professionals in the community that have seen the victim in their care, such as CPS reports, school records, and teachers. If present danger is identified, then it would be imperative to provide the victim and their family with feedback and to help the caregiver to create a safety plan so that the victim and the family can be safe. With the information, caseworkers and therapists are better able to locate much needed resources and services. So, what questions should be asked to determine the type of treatment that is needed for individuals and family? Therapists would likely use a neutral stance, using an array of questioning methods such as directive questioning, forensic prompts, and cue invitations. Using directed, open-ended questions helps to eliminate any biases that the interviewer may have, and it also helps to eliminate suggestibility or persuading the child to give a false answer. Open-ended questions helps the child to tell their story as they recall them from their memories and their perspectives in a more accurate manner than using other methods of questioning. Once the child has answered the question, they can then be encouraged to elaborate their responses. Cue invitation questions help children to elaborate their suggestive experiences. Forensic interviews helps to determine if someone has endured abuse by investigating the allegations of abuse and gathering, certain evidence of factors such as if they're safe or not. Here is an example of some questions that I would use. I would ease a child into answering questions by asking the child a question, that's unrelated to abuse, that would help them to open up, such as tell me about yourself. Or if they have a toy, I would say, what did you bring today? Tell me about your toy. Or what do you like to do? Followed by, who brought you here today? If the child has not provided clarity on why they are here, the therapist might ask for more clarity by asking the following question. Can you tell me the reason you're here today? Number 3, can you help me understand what happened to you? If the child has then indicated what kind of abuse, you can then ask, can you tell me more about when this happens? So a cue invitation for physical abuse would be, you mentioned your daddy hits you. Can you tell me more about that? A cue invitation for sexual abuse might be, you mentioned Uncle John kisses your tummy. Can you tell me how Uncle John kisses your tummy? A cue invitation to explain neglect would be, you said when you are at school that your tummy hurts because you're so hungry. Can you tell me about when this happens to you? A treating therapist must be mindful of the symptoms and assessments results presented. You want to choose a therapy that is evidence-based, but also focuses on cognitive behavioral therapies because of the specific symptomology that they focus on. Therapies included are 1. Trauma-focused cognitive behavioral therapy, which treats symptoms of PTSD, anxiety, and depression. Number 2 is the parent-child interaction therapy, which treats problematic behaviors such as aggression, emotional dysregulation, and children with disabilities. 3 is alternatives for families and cognitive behavioral therapy, which treats physical abuse, aggression, and works on conflicts in the family. Number 4 is the cognitive behavioral play therapy, which treats interpersonal family violence, trauma, but also addresses aspects of cognition and behavioral through play therapy. Cultural factors are very important to understand. Not all families are going to be alike, even within the same cultural group. Western ways of thinking may differ in norms, values, and traditions found in other cultures. As an example, a cultural group may feel the use of severe spanking is an acceptable form of punishment. Because of these diverse perspectives on abuse, the counselor must take a person-centered approach and use trauma-focused as well to validate the clients in their grieving process, to focus on strengths and ways they can heal from maltreatment. As with all clients, it's imperative to provide the family with informed consent, which would explain the therapist's role in helping the family and victims. Therapists can offer client psychoeducation material that explains maltreatment in the victim's language, breaking down language barriers by offering to explain what certain words and laws mean, as well as using language that is understandable for families. It's imperative to keep in mind that many individuals who are from diverse racial backgrounds, individuals from collective cultures, likely would want to protect the reputation of the family. Disclosing child mistreatment can cause the victim to feel guilty and responsible for the abuse they're enduring and fear losing vital relationships they have with others in their family unit. It's imperative to avoid causing harm by not pushing conversations that the client finds uncomfortable. Furthermore, the therapist should give the client autonomy in their own decision to disclose maltreatment. It's important to use a professional interpreter if the client speaks a language that the therapist is not familiar with, and to not rely on other family members who do not have the ability to fully participate in treatment. Mandated reporting in California. People who are mandated reporters are public and private school employees such as teachers, administrators, school counselors, principals, but also includes classified employees such as teachers' assistants, campus security, and others who work in some capacity with children, administrators and employees of day camps, youth centers, and diverse organizations that work directly with children. Those who work in daycares, Head Start programs, coaches, public work employees, and those who serve the public like police officers, probation officers, child visitation officers, and firefighters. Those in the medical field, such as physicians, which includes all specializations. Individuals working in the mental health field, which includes medical assistants, volunteers, and interns. Individuals who work in churches, foster care families, employees in group home, as well as officers of humane society and animal control organizations. Individuals who are mandated reporters who have a suspicion that there is a child who has been harmed in any way or is not having their basic needs met of food, shelter, and chronic untreated medical conditions or lack of appropriate clothing must report physical, emotional abuse or neglect. So steps to take for suspected abuse. Those who are mandated reporters can contact local law enforcement agencies such as social service agencies or local child protective services in mandated reporters' counties by phone. Once the incident has been reported over the phone, a mandated reporter has 36 hours to fill out and send a written report using the BCIA 8572 form, and they must have that returned to a local district attorney office. Individuals who are not mandated reporters can still report abuse under the Penal Code 11165-9, which would require the person to file a Child Abuse and Neglect Reporting Act. Any reports must be kept confidential and are seen as reporting in good faith. Information on where to report child abuse and neglect in California can be found at the Department of Social Services webpage, which lists child abuse reporting telephone numbers for every county in California. If a parent or caregiver suspects that their child has been abused by someone they know, such as a family member, the parent can file a report with a local Child Protective Service agency, which will see the family that they receive specific evaluations such as medical and psychiatric assessments. Thank you for participating in this training on systematic child abuse and neglect assessment. I hope that it has helped you and that you have a better understanding of how we can assess and offer the best treatment measures for victims and their families. I am your presenter, Cecilia Dunn. Goodbye for now.